so let's just go into what up to date says, right? Because what I'm telling you is what I remember. But let's check kind of the gold standard. So this is the checklist for accurate measurement of blood pressure. And so step 1 is properly preparing the patient. The patient should avoid caffeine, exercise, smoking for at least 30 minutes before measurement. I'm very caffeine sensitive, and that's why I mentioned the caffeine thing when I remembered it yesterday. I'm a little surprised and disappointed they didn't ask me, but we're all human, we forget things. But I only had I usually drink, if I do drink caffeine, it's decaf. But yesterday I had just regular, but it was only 1 shot of espresso, and I had it hours before. But again, I think the fact that I'm caffeine sensitive affects things. It can still, yeah, the effects last longer in my body is what I have found for myself, at least. So it makes sense of all of this. And smoking, I actually didn't know that smoking would affect things, just even acutely. Long-term smoking almost always maybe, affects your blood pressure. That's why one of the reasons or things that we'll tell patients if they do smoke regularly for lowering blood pressure is to try to stop smoking. I know that's hard. 2, ensure the patient has emptied their bladder. Oh my God. Yeah, this too. Later on, I was like, oh my God, I was sitting there having to pee. Even though I peed already, I peed 3 times over the course of waiting for I don't know if she was a physician assistant or a nurse practitioner, but I was waiting for the clinician to come in, and then I had to pee after my blood pressure was taken, and then I had to pee again. But the reason why is actually the caffeine. That's how sensitive I am. It makes me pee like crazy. So anyways, make sure a patient has emptied their bladder before taking it. Having the patient relax, sitting in a chair, feet on floor, back supported for over 5 minutes. Remove all clothing covering the location of cuff placement. That's really important. I've seen doctors, med students, whatever, medical assistants, all that. Sometimes they'll just try to do it over your shirt, and sometimes if it's a thin shirt, even I was trained of it's okay if it's a thin layer of clothing, but ideally removing all clothing. And that's why I made sure to wear a t-shirt yesterday too, instead of some long sleeve shirt. Neither the patient nor the observer should talk during the rest period or during the measurement. The patient should refrain from using electronic devices, phone, tablet, computer during the measurement. Again, we're really trying to control a lot of factors, but I don't think this almost never happens for me, or never. Can't really recall any times where this has happened, where medical assistant wasn't just trying to make small talk, which is nice of them, but it affects the measurements. Measurements made while the patient is sitting or lying on an examining table do not fulfill these criteria. Okay, this is actually new to me, and I'm glad to learn this, because there's been quite a few times at clinics that I've worked at that sometimes if the patient is, sitting on an examining table, because your feet are going to be hanging unless they have that little stool where you can, or ledge where you can rest your feet at. But unless the back of the examining table, if it has that ability, is lifted up to support your back, that's not going to work either. And some doctors' offices have the old school tables where you can't adjust it at all, right? It's just basically a wooden table. Lying down, this part is interesting just because what I was saying is that a lot of places where I've practiced medicine, if the patient is sitting and we did a proper measurement, which no, with 15 minutes per patient, how do you, a lot of times that doesn't happen. Then in a lot of places, we'll then have the patient lie down, we'll turn the lights off, and sometimes, or sometimes not, depends, it's not like I'm watching over the medical assistants all the time. We'll ask them to not be on their phones or anything. We'll want them to just close their eyes, try to relax and all that, and then retake their blood pressure, but usually we'll retake it lying down. And so apparently that's not proper. So that's good to know, because I mean, the idea is that the more relaxed you are, usually your blood pressure is fine. But that's really good to know. That just, it doesn't count. All right, using proper technique. That's important too. So proper technique, using a blood pressure measurement device that has been validated, and ensure that the device is calibrated periodically. Oh my God. This is, again, so important. There's an asterisk here, so I kind of want to see what they're saying. Devices should be checked at least twice yearly against a mercury sphygmomanometer for accuracy. I used to know how to say that more quickly. At least twice yearly. But yeah, the calibration is important, right? Because if your measurement device is off, then it's all off. And I don't know how regularly doctors' offices calibrate. I doubt that they do it. And I've even brought in my own blood pressure machine to ask the clinic to compare, and I don't think the PA who saw me did it properly, or there was a big difference between the two. And so, I don't know. Yeah. Anyways, to support the patient's arm, resting on a desk, table, whatever, at heart level. Position the middle of the cuff on the patient's upper arm at the level of the right atrium, the midpoint of the sternum. That's really interesting. Yeah, I guess that makes sense. The sternum is your, I forgot if there's a common name. It's just that stiff bone in the middle of your chest, right? Between your ribs, between your boobs, your chest, whatever. And the right atrium is one of the chambers of the heart. There's 4 chambers in it. And so I guess that's kind of roughly, that's where the right atrium sits, around the midpoint of the sternum. That makes sense if I just kind of check myself in my sternum. But I'm like, the sternum, does that include the manubrium or xiphoid process, which are other anatomical parts of that midline strip in the front of your chest? I don't know. That gets into details that I'm kind of curious about, but I know I can get very neurotic on things that might not matter that much in the big scope. But anyways, middle of the cuff at that level. Okay, I don't know if I've heard that, but the cuff usually isn't that big anyway. But yeah, you know what? Next time I take my blood pressure, I'm going to try to make sure to follow this. Correct cuff size. That is really, really important. That's why you see like smaller cuffs, bigger ones, pediatric size ones. So use the correct cuff size such that the bladder encircles 80% of the arm. So the bladder is just the part of the cuff that like puffs up. Encircles 80% of the arm, and note if a larger or smaller than normal cuff size is used. I believe if you use like a smaller cuff size than you need to, then the blood pressure will misread and be higher. And sometimes if you've had this happen where if they put on too small of a cuff, as it inflates, the Velcro just comes off. So like that already is a sign that like that size is not right, or unless they didn't Velcro it strong enough. And then if you use a larger than normal cuff, then it'll kind of underestimate your blood pressure. All right, using an oscillometric device if available. I don't know what that is, actually. That's a good question. I'll have to look it up for later. If taking auscultatory readings, either the stethoscope diaphragm or the bell may be used. So auscultation just means listening. And so I guess they actually prefer that you don't use, like doing it by hand, which is what I always learned and thought was the most accurate way, that they, the doctor or whoever, they put the cuff, they stick the stethoscope underneath it, and they read it. But since it says if taking blah, 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 then I'm guessing oscillometric devices are like those battery powered ones. But I'll have to look into that actually. And maybe I'll post it in the comments or in the description or something. So this is interesting too, that when you use a stethoscope, there's two sides. Well, it depends on the stethoscope. The better ones or whatever are two-sided. There's the diaphragm, which is the flat side, and the bell is usually smaller, and it's more of a cup-shaped side. And when I was learning it in med school, they actually, whatever doctor was teaching me, said that the bell was better. You could hear like, I think you can hear deeper sounds with it, deeper as in like lower volume, something like that. There was something like, oh, lower pitched. That's what I'm trying to say. Lower pitched sounds with the bell. And so that's how I learned. But then when I studied under another doctor, he kind of yelled at me and said, what are you doing? Use the diaphragm, which is bigger. And so you can be less accurate because you have to put it over this blood vessel, which is, it's less accurate, but you don't have to be as accurate, and it covers a bigger area. And he's like, you can hear it better this way, but I noticed the difference. It wasn't as loud when I used the diaphragm, but because he got mad at me, and almost everyone actually uses the diaphragm, I switched over to the diaphragm. But it's nice to know either works.